everyone. This is Dr. Pam Smith, and she is joining us from the East Coast. We are delighted to have her tonight, and she is going to go over 7 major ways to, or 7 minor ways, 7 wonderful ways to maximize your immunity. And with that, she has some fantastic information that I believe that everyone is going to be able to use today and wake up tomorrow morning and be on a better pathway to health. So I'm going to turn it over to Dr. Smith. Thank you again for joining us. Looks like we had about 49 people registered. So Scarlett's going to get a hold of those that have yet to join us. And so take it away.
Good evening, everybody. I hope you are all doing well. We're going to spend a little while tonight looking at maximizing your immunity. If you have questions, please type them in the chat box. I will also stop in the middle and ask for questions that you're welcome to unmute yourself as well. We're going to look at 7 ways that you might be harming your immune system and how you can fix that. We're going to look at stress and anxiety, alcohol, lack of sleep, an unfriendly diet, dehydration, lack of exercise, and smoking. Stress management is very important for your immune system. When you're stressed, literally, the immune system is compromised. Cortisol is your stress hormone. It's the only hormone in the body that goes up with age. It's made by the adrenal glands. And when you stay stressed because of a busy world and all the craziness that's going on and overbooking, cortisol elevates. Cortisol has a lot of functions in the body. It's anti-inflammatory. It affects pituitary, thyroid, and the adrenal system. It participates with aldosterone and sodium reabsorption. It balances the other hormones, influences sleep, protein synthesis, mood, DHEA and insulin, balances blood sugar, influences weight control. It's involved in the stress reaction, and it really does balance the immune system, and it influences bone turnover rate. One study suggested that as many as 75 to 90% of visits to primary care doctors are stress-related. And honestly, I cannot think of any disease process that is not caused by or made worse by staying stressed. A little bit of stress actually invigorates you. You don't want it to be distress. Chronic stress has been shown to contribute to accelerated aging and premature death in medical studies. Another study revealed that chronic stress accelerated the aging process and was associated with shortened telomeres. So what are consequences of elevated cortisol? Certainly, very much compromising the immune system. It decreases the release of antibodies. It causes an inhibition in the proliferation of T cells. As you've seen, COVID is a T cell disease. It increases inflammatory cytokine production. COVID is actually a disease process where people get severe COVID, have an increase in inflammation and what they call cytokine storm. If cortisol stays high, it inhibits the release of some interleukins. There's latent virus reactivation. In fact, many of us do believe that COVID long haul, where you have symptoms after COVID is gone, may be a reactivation of other viruses, such as Epstein-Barr. There's a shift between Th1 to Th2 expression. So the immune system changes, and there's an increase in infection. All these other things happen if you stay stressed. Fatigue, irritability, bone loss, sugar cravings, blood pressure goes up, your blood sugar goes up. The thyroid regulates your entire body, and your thyroid hormone or thyroid gland makes 2 hormones, T4 and T3. And your body is supposed to convert T4 to the more active T3. That conversion does not help very well. It doesn't happen if you stay stressed. Binge eating, confusion. People have brain fog, shakiness between meals, The memory is not as sharp. Cholesterol does go up, as does the fat content in the vessels, which are your triglycerides. Night sweats. A lot of patients will tell us, oh my gosh, I have terrible night sweats. Do I need estrogen? What is going on? For most people in today's world, the night sweats are actually due to stress. Thin skin, easy bruising, muscle weakness, weight gain around the middle, sleep disturbance. And when you stay stressed, it favors the development of what we call leaky gut syndrome, which we're going to talk about tonight. That's so important because your gut, the GI tract, is 70% of your immune system. So all these diseases in the medical literature have been associated with stress. And I'm sure there's actually many more. So when you're stressed and cortisol goes up, that's called hyperadrenalism. When it's too low, that's hypoadrenalism. So when cortisol's high, stress reduction techniques are key. Prayer, meditation, Tai Chi, yoga, Qigong, exercise, massage, acupuncture, breathing techniques. The same thing you would also do if cortisol was too low. Also a multivitamin. The body does need vitamin C, B, calcium, magnesium, zinc, selenium, copper, sodium, and manganese to help the body process cortisol. There is a companion hormone to cortisol. It is called DHEA. And if it's low, we do replace it as well. We commonly give adaptogenic herbs to help the body normalize cortisol. If it's too high or too low, then we still give rhodiola, ginseng, ashwagandha. These help cortisol balance. If the patient is very stressed, then calming herbs are wonderful. Lemon balm, chamomile. If cortisol stays high in the evening, then we give a nutrient called phosphatidylserine. P.S. Or phosphatidylserine also increases memory. So you kind of get a 2-for-1. For hypoadrenalism or low cortisol, we do the same things. If that's not enough, then we take the patient after 6 or 9 months off of adaptogenic herbs and instead start extracts, adrenal extracts. They're purified. You can still add licorice, not the candy, but the herb licorice. It cannot be given to people with high blood pressure. If you develop high blood pressure while taking it, you must come off. Then there's the medication Cortef. It really is used at last resort. You have to have cortisol to live. If you do not have it, you die in 1 week. So the way the body works is you have this hormone, which is your hormone of memory. You may want to write it down because it's hard to say and hard to spell. It's called pregnenolone, Pregnenolone. That's Pregnenolone, pregnenolone. It makes DHEA and cortisol, estrogen, progesterone, and testosterone in the body, but it will preferentially make cortisol to keep you alive if you stay stressed. Then all of your other hormones become out of balance. The second item is alcohol. It doesn't mean don't drink. It means moderation is the key to health. Alcohol abuse suppresses multiple arms of the immune response. This does lead to an increased risk in infections. The course and resolution of bacterial infections and viral infections in this medical trial was shown to be severely impaired in people who abused alcohol, resulting in greater morbidity and mortality. Several studies have detected a dose-dependent effect of alcohol on human health, with a light to moderate drinkers having a big-time problem. Small amount of alcohol consumption actually may decrease inflammation and have a good response, but many drinks chronic alcohol abuse does compromise the immune system. Lack of sleep. Optimal hours of sleep are 6 to 8 hours. Want to go to bed by 11 p.m. and not arise before 4 or 5 a.m., optimally 5 a.m. Some of my patients tell me, oh, I'm going to get up at 4 o'clock and exercise. Believe me, I love them exercising, but getting up at 4 a.m. to do it is probably not the best idea. If you get up before 5, it does change the circadian rhythm in your body, meaning the sleep-wake cycle. This medical study showed the disturbance of the circadian rhythm and causes an increased incidence of psychological diseases. So if your sleep-wake pattern is not good, it increases your risk of depression, increases your risk of cancer, heart disease, diabetes, and compromises your immune system. Melatonin is your hormone of sleep. It's so important, but it also builds the immune system. Melatonin has been shown to regulate blood pressure and blood sugar. Low levels of melatonin increase the risk of developing heart disease, stroke, Parkinson's, cognitive decline, and now it's showing that people that get COVID and a more severe case, many of them do have low melatonin levels. If you want to know if you're low, you can measure it. It is a saliva test, and it's measured at 8 in the morning, 5 p.m., and 3 a.m. with the lights off. You want to get really a good night's sleep. You don't want to take too much melatonin, high melatonin levels, lower serotonin, which is your happy neurotransmitter. Melatonin does all of these things. In fact, it is so important for your immune system that we use melatonin at large doses to treat stage 4 breast cancer. It is an antioxidant, so it gets rid of free radicals. It helps get rid of inflammation. Almost every single disease you can think of after the age of 40 is inflammatory in nature. And again, COVID is as well. So melatonin is not just for sleep. It does all of these great things. How do you have low melatonin? Eating too many sugary foods, abusing alcohol, too much caffeine. Again, that doesn't mean you shouldn't have a cup of coffee or an iced tea or an iced coffee. 1 to 2 cups a day for most people is fine. When you go to the 3rd cup, then it may lower melatonin. Tobacco, the aging process. But the number one reason people have low melatonin is electromagnetic fields. So I really do turn off my computer and my cell phone unless I have someone in the ER, because I don't want my own melatonin levels to be crazy. So try turning this off. You'll do better at night. Melatonin is used to prevent and treat all of these diseases. You can have too much of a good thing. So if you have too much melatonin, you may have daytime sleepiness, fatigue, depression, headaches. Cortisol may go up and you store fat, intense dreaming and nightmares, suppression of serotonin, which increases carb cravings. So there's an actual melatonin saliva test. An unhealthy diet is a major problem. Before we look at this, I'm going to go ahead and open it up to questions. We do have something in the chat box here. And melatonin and pregnenolone are available without a prescription. We also like to have it compounded because then we can get a dose that may not be available over the counter. Any other questions? please put them in the chat box. We're going to proceed on to an unhealthy diet. Decrease sugar intake. When you look at sugar and the immune system, the consumption of 20 teaspoons of sugar per day can reduce the immune system's functioning up to 50%. In fact, from Nancy Appleton's work, sugar suppresses the immune system. So what are the actual stats with sugar? The average American consumes anywhere between 150 to 170 pounds of refined sugars in 12 months. A century ago, the average American consumption was only 4 pounds of sugar in that 1 year period of time. Men consume a little less. Foods do contribute 67% of calories from added sugars, and about 13% of adults' total caloric intake comes from added sugars. Refined sugars basically have no vitamins, minerals, proteins. They're just carbohydrates. From Patrick Quillen's work, sugar feeds cancer cells. In fact, we all get cancer. Most scientists believe 6 to 8 times in our lifetime. There are 2 things that fuel cancer, literally feed the cells: sugar and stress. Sugar can affect the youthfulness of the skin. I do have an issue with sugar, but as I age, it's like, this is the biggest thing. I want my skin to look better. Let's cut down on the sugar. It can promote tooth decay. It can cause weight gain. Sugar increases the risk of bowel diseases. It can cause arthritis. Sugar causes inflammation. Arthritis is an inflammatory condition. Sugar can lead to candidiasis, which is a yeast infection. It can increase gallstone formation. It can increase your risk of heart disease, kidney stones. It may exacerbate MS. It can cause insulin resistance, which leads to diabetes. Sugar lowers growth hormone, the hormone that literally keeps you young. Sugar can increase systolic blood pressure. It can change the structure of protein. It can impair the structure of DNA. It can affect your eyesight. Diabetic retinopathy is the 3rd leading cause of blindness in people over the age of 20. It can even cause cataracts. Sugar can cause free radical production, a fatty liver, increased fluid retention, causes constipation. It decreases tendon function and repair, and it can cause an increase in delta, alpha, and theta waves, which can alter cognition. Sugar can cause depression. A lot of patients will say, oh, well, I eat sugar because it gives me a high. That high lasts about 2 hours, and then you crash. Then you eat more sugar and you get into this catch-22 situation. It increases fermentation of the bacteria in the colon, can cause platelet adhesiveness. There's hidden sugars, and some of these I found very surprising. Yes, sugar is found in alcoholic beverages. About half of the calories in ketchup came from sugar. I honestly didn't know that. I eat a lot less ketchup now. Sugar is used in many luncheon meats. Breading on many products contain sugar. Salad dressings frequently contain sugar, and sugar in restaurants is often added to hamburgers to prevent shrinkage. So it's one thing to say, oh, I really would like to have this brownie. It's my birthday. I want to eat it, versus the hidden sugar that you might not realize is in your salad dressing. Sugar is the most addicting substance on earth. It is. They actually did a laboratory study. They put out 2 bowls for the little laboratory animals. In one bowl, they put cocaine. In the other bowl, they put sugar. Guess what happened? All of the little laboratory animals ran to the sugar and not the cocaine. You are what you eat. So how your gut works is one of the most important things that you can work with and change to help your immune system. Because again, 70% of your immune system is in the gut. So what are signs of poor digestion? Less than one bowel movement a day, undigested food in the stools, foul smelling stools. You feel better if you don't eat, chronic indigestion after eating, poor sleeping habits, waking up tired. You feel cold with no reason. Other signs of poor digestion, depressed with no reason, frequent burping, passing gas, or bloated stomach, feeling stressed, and there's really not a cause. You need to loosen your belt after eating, even if you haven't overeaten, a chronically coated tongue, and an increase in your pulse of 20 to 25 beats within 15 minutes after eating. So what are signs of optimum digestion if that's poor? 2 bowel movements a day. This is always surprising to everybody. Some patients say, oh, we have 1 bowel movement a week. Your bowel is a major organ of detoxification. Healthiness is 2 bowel movements a day. Other signs of optimal digestion: no undigested food in the stools. Stools do not smell. They feel good after eating and several hours later. You sleep well and you wake up feeling really rested. Warm extremities, good energy level throughout the day, no extreme food cravings, feel better after exercising, and you don't have mood swings, anxiety, shakiness, and depression without a reason. So you can end up with inflammation in your gut. Particularly common is dysbiosis. This is an imbalance of intestinal bacteria. In other words, too much bad bacteria and not enough good. So symptoms associated with dysbiosis, and you may have had some of these, or maybe you're having some of them tonight: nausea, belching, bloating, heartburn. It is not normal and it is not healthy to have heartburn. Abdominal pain, cramping, abdominal distension, depression, anxiety, altered bowel function with constipation and diarrhea, cramps and spasms, hypersecretion of colonic mucus, flatulence, halitosis, meaning bad breath. These are symptoms of having dysbiosis, which is too much bad bacteria and not enough good. But sometimes people have symptoms of dysbiosis that occur outside of the intestinal tract, and they don't even realize they have a gut problem. Arthralgias, anxiety, brain fog is a common one. Cognitive and memory deficit, depression and fatigue, fever of unknown origin, frequent urination, malaise, myalgias, palpitations can be an extraintestinal symptom of dysbiosis. Phlebitis, pruritus, which means itching, skin rashes, seizures, vasculitis, where you have inflammation of the vessels. So how do you have dysbiosis? Well, you can have agents that end up being toxins into your body. Antacids can cause it. In fact, a medical trial showed that 40% of people that were prescribed a PPI for their reflux and too much acid, they actually had reflux because they had too little acid and not too much. Other causes of dysbiosis: poor nutrition, basically the standard American diet. That's why I think the acronym SAD or SAD is so apropos. Free radical production, stress, alcohol abuse, antibiotic use that's common, and non-steroidals can cause dysbiosis, and so can viruses. In fact, one of the main things we are seeing now with COVID long haul syndrome is people who have problem with their GI tract caused by the COVID virus. Other causes of dysbiosis: diminished hydrochloric acid, decreased enzymes, diminished bile, food allergies are a big reason why the gut's not healthy, travel, even exposure to extreme altitude, yeast infection, and lectins. This is actually the mechanism where nonsteroidals break down the intestinal wall. So things that are used commonly for pain over the counter. It literally damages the mucosal lining of the gut. It damages the mitochondria, which are the engines of the body. You end up with breakdown of intercellular integrity. There's recirculation of waste products from the liver and activation of neutrophils caused by the escape of bacteria and large molecules of undigested food. Then you have a compromised intestinal barrier and you end up with leaky gut syndrome. The barrier in your intestinal lining is supposed to be what we call semi-permeable, meaning bad things are supposed to leave and stay out and good things stay in. Viruses like rotavirus have proteins on their outer surface that can open up the cellular spaces between the tight junctions, and you end up with leaky gut. And again, we are seeing this with COVID. Lectins, they are protein fragments of foods that are not completely digested. They bind with specific sugars on the surface cells throughout the body. They stick to the lining of the GI tract. This causes inflammation and it can destroy cell membranes. Lectins flatten the intestinal villi, so they decrease absorption of nutrients. Your gut is so important, not just for the immune system, but almost all the biotin you make for hair and nails is made in the gut. Vitamin B12, it regulates some of your hormones. Serotonin, your happy neurotransmitter, 90% is made in the gut. Again, moderation is the key to health, but excessive alcohol use can disrupt the tight junctions and lead to leaky gut. So what are consequences of dysbiosis? Loss of good bacteria, loss of vitamin production, like vitamins B12 and vitamin K, loss of the ability to detoxify, loss of chemical and antibiotic protection, and overgrowth with bad bacteria. And then if you have long-term dysbiosis, this does lead to leaky gut syndrome, and you can literally get your medication twice. So common conditions associated with leaky gut are numerous. I'm not going to read them because that would make this a very boring talk, but I put this here and I'm going to go slowly for you to look at them because they are in alphabetical order. And you can see with just this first slide, we only got to C. So common conditions associated with leaky gut syndrome. So if you have an unhealthy gut, what do? Remove, replace, repopulate, repair, and rebalance. So you remove bad things. You replace good things like digestive enzymes. You do repopulate with good bacteria, which are called probiotics. We also give prebiotics after the first month to provide food for the good bacteria. And there's actually programs called the Total Gut Restoration Program, where it is just like it sounds. You start with a probiotic, add the prebiotic the next month. The third month, you add very important nutrients to fix that lining of the gut so you don't have leaky gut syndrome. You do want to repair and then rebalance the body psychologically as well. So there's your remove, replace with digestive enzymes, bitters, and hydrochloric acid. In fact, digestive enzymes enhance digestive health. They reduce autoimmunity. If you have an autoimmune disease, and there's now 106 of them your gut is not healthy. So if you have Crohn's, MS, Hashimoto's thyroiditis, chronic Lyme disease, there are many autoimmune diseases. We can do a gut health test and take a look and fix your GI tract. Digestive enzymes are decreased post-surgery. So if you give digestive enzymes, the recovery time is improved. Digestive enzymes are used in place of nonsteroidal drugs like Motrin in Europe, and digestive enzymes reduce the effects caused by radiation and chemo in people who have cancer. You can't take digestive enzymes if you have an active ulcer or if you have an inflamed bowel. You have to wait till it settles down. The patients on Coumadin, which is a blood thinner, then papain, which is in digestive enzymes, would be a problem. So we would find digestive enzymes for you that don't contain the papain. So how do people get enzyme depletion? Pesticides. It does matter if you eat organic. Hybridization and genetic engineering of plants. Bovine growth hormone used in livestock. Pasteurization can cause enzyme depletion. Irradiation of food, and large intake of unsaturated and hydrogenated fats. Other causes, cooking at high temperatures, microwaving depletes the body of nutrients and enzymes. Fluoride in the water, radiation and electromagnetic fields, heavy metals like lead and mercury, mercury amalgams, root canals, and hidden dental infections can all cause the enzymes to be decreased. So when we look at digestive enzymes, if they're taken with food, they improve digestion and can help heal leaky gut. If they're taken on an empty stomach, then they're anti-inflammatory. Not everyone needs to take digestive enzymes. Many people, if you fix their gut, they will go back and make their own digestive enzymes. Bitters, they trigger the release of digestive enzymes in the mouth. They increase the release of hydrochloric acid. They enhance the production of bile, and they increase the production of saliva and gastric juices. Yes, your body does make hydrochloric acid. It has to be acidic for many reasons in your gut for you to be and stay healthy. Bitter herbs have been used to treat sluggish digestion, flatulence or gas, bloating, dyspepsia, bowel tension, or distension. Lots of different herbal combinations for bitters. You can even eat your way into it. You can have a bitter salad with dandelion, endive, etc. Repopulate with good bacteria. There's your prebiotics and probiotics. Probiotics are so important. In fact, spore technology is really important. We like spore probiotics because they survive digestion. They actually survive antibiotic use. Probiotics make short-chain fatty acids like butyrate and propionate. Butyrate is very important for energy. Propionate is very important for T cell function, that part that really fights things like COVID. Probiotics produce digestive enzymes. They act like natural antibiotics. They maintain optimal pH of the intestine. They help digest fats. They make B vitamins, help detoxify, produce lignans to protect against cancer. They help protect against parasites, and they maintain a good intestinal lining, which protects against food allergies. All of my patients in my practice take three things: a multivitamin, fish oil, and probiotics. Many of them also take prebiotics as well. Repairing the gut lining. So we add nutrients that belong with immunoglobulins, amino acids, very, very important. And then lifestyle balance, yoga, meditation, good sleep hygiene. I'm going to stop here and take questions as well. So let's see what's in the chat box here. Common foods that contain lectins, I listed some on there: soybeans, beans, potatoes, etc. A good probiotic. Well, I really do like the spore technology. So Megaspore Biotic is one of my favorites. You do have to ramp up the dose, so that if you're not on a probiotic already, you would take one every other day for the first week. The second week, you take one a day. The third week and thereafter, you take two a day, which is the therapeutic dose. I wait a whole month and build up good bacteria, and then we give the prebiotic, which is Mega Pre, which is literally good food. It feeds the probiotics. Many people do need to repair the gut lining. Not everyone, but certainly most people after the age of 45, or anybody with an autoimmune disease or cancer. And then we use Mega Mucosa. I use that in my practice. I love it. I know the pharmacy uses it as well. It has a lot of things in it. It's a powder, and it really heals the gut lining with immunoglobulins, etc. Someone asked, how do you check gut health? Well, there's first generation test, which look at 1/16 of the genomes of the bacteria in your gut, and there's second generation test. The second generation test that's on the market is called Biome FX. I do that in my practice. The pharmacy also carries this test. It is a stool test. It is extremely comprehensive. You get a 20-page report back, but if you don't have a healthy gut, you're not healthy. So this is new technology. It's absolutely fabulous. I love being able to do the Biome FX test. It's done by Closman ID Lab, which is the same lab that does the blood work for the White House, no matter who's sitting in the White House. So it's a very, very comprehensive test. Other questions? Feel free to unmute yourself or type in the chat box. And someone just said that Makers does carry all of these. They do. So that came from Michelle Moser, a pharmacist there. It really is a good product line. Next thing we can do is try and not be dehydrated. Make sure that you drink enough water. There's no substitute for water. If you have normal kidney function and you don't have congestive heart failure or some reason you can't take on a lot of water, you should drink 1/2 your body weight in ounces every day, another 20 to 40 ounces if you're exercising that day. And no, soft drinks are not water. There's no substitute. Even juice is not water. In order to avoid dehydration, it really should be water. What else can we do? Exercise. This one is my personal hard one for me. I don't get the high some people get from exercise. Maybe you guys do, and if you do, bless you, because that's absolutely wonderful. Exercising 3 to 4 times a week, doubling your pulse for 20 minutes is absolutely fabulous. Now, if you are a couch potato and you haven't been exercising, and a lot of people don't exercise, if you haven't been, then before you begin an exercise program, if you're over the age of 40, then do see your doctor for an EKG. If you exercise 5 days a week or more, that's an aggressive exercise program. And at any age, if you're 24, 50, or 80, if you aggressively exercise, you do need additional nutrients. I'm very blessed in my practice to see professional athletes. Even if they're 27 years of age, they're exercising 7 days a week, and they do need additional nutrients. The pharmacist at the pharmacy can help you with those. Otherwise, you can have not enough energy if you don't have those nutrients. You can actually do damage to your muscles. If you're over the age of 50, everybody is depleted in lipoic acid. That is one of the nutrients. Lipoic acid, you cannot eat your way into. Be great if you could. At 50, everybody should take 100 milligrams a day. If you have a blood sugar problem, or if you exercise vigorously, then it's 300 to 400 milligrams a day. If you're taking something for your blood sugar because it's high, like metformin, and you start lipoic acid, then most people will need less metformin. Coenzyme Q10. This also gets depleted with age, and it also gets depleted with vigorous exercise. At least 100 milligrams a day. You cannot eat your way into coenzyme Q10 either. People need bigger doses for many reasons. This is 1/3 of the fueling source in your body. It's part of something called the Krebs cycle. Coenzyme Q10, if you need more, and maybe due because you exercise a lot, which is great, but you would need 300 to 400 milligrams. Also, 4 of the major 7 drugs that are given in the United States deplete the body of Q10. Every single medication that is prescribed causes between 2 and 10 nutritional depletions. So if you're taking metformin, you're depleting Q10 and B vitamins. If you're taking hydrochlorothiazide, which is a water pill, your prescription says HCTZ, you're depleting Q10. If you are taking a statin drug, you are depleting Q10. If you're taking a beta blocker, anything that ends in OL, then you're depleting Q10. So how much do you actually need? If you're 50, 100 milligrams for each drug, 100 milligrams if you have normal liver and hepatic function. There's no regulation on vitamins in the United States. So there's no rules. You can get toxins in them. So you should take pharmaceutical grade nutrients. Pharmaceutical grade nutrients are very, very, very important. Pharmaceutical grade means it's free of toxins and it's bioavailable, so it gets into your body and does what it's supposed to do. Magnesium glycinate. Magnesium is a cofactor for over 100 reactions in the body. It has a nice calming effect. The body does balance. Calcium excites, magnesium relaxes. Vitamin K2 is important if you're an aggressive exerciser. It's also important for bone health, heart health, helps treat peripheral neuropathy and other things. D-ribose, it's a powder. It's great if you're an aggressive exerciser, NADH, and the amino acid L-carnitine. Now, L-carnitine is a little tricky. If you have a high TMAO level, which your doctor can do, it's a blood study at any major hospital, Quest or LabCorp. If it's high, then L-carnitine is not for you, or it increases your risk of heart disease. It does invigorate you, but if you have a high TMAO, all the rest of the other nutrients, if you're an aggressive exerciser, we also use this for people who have long haul COVID. Smoking. If you smoke, or if the patient smokes, don't smoke. I mean, honestly, 1 billion people in the world still smoke. It's amazing to me. And let's face it, not everybody who smokes gets lung cancer. In fact, most people who smoke don't get lung cancer, but all of them, if they live long enough, get memory loss. If you smoke, if you live long enough, you get heart disease and hardening of the arteries, which can lead to a heart attack, or it can lead to a stroke. If you smoke, you have a dramatic increased risk in macular degeneration, and you can lose your vision. And if you smoke, you do have a compromised immune system. So in conclusion, if you've seen, there are many ways to build the immune system. You can be very, very healthy. It is all about balance. You're able to do all of these things. I love this motto. Life is not about how to survive the storm, but how to dance in the rain. So very important. We'll open it up to questions. I'd also like to make a very important announcement for people who have never heard of this. This is called Covix RX. This is iodine nasal spray, and it is a great adjunct to other therapies to help prevent and treat COVID. That does not mean that you should not have a vaccine. That's not a comment on mask wearing. It's a comment that there are clinical trials showing that iodine as a nasal spray is very effective against COVID and other viruses in conjunction. So it gives you an added layer of protection, which is very important. Questions?